Assalamu alaikum, welcome to Hijama Nation TV. I'm Omar, the co-founder of Hijama Nation. We'd like to welcome you to today's episode. I'm really excited to have our special guest and close friend on the call today. Our guest is actually highly specialized in not only Hijama Cupping Therapy, but is a doctor of Unani Medicine. Her name is Dr. Ghazala Mulla. She's based in Pune in India. She's an associate professor and head of the department in the Unani Medical College. That's a mouthful, but I think it's correct. So I'll ask Sister Ghazala to explain it in more detail shortly when we do the introduction. But make sure you watch till the end today because Dr. Ghazala has some amazing case studies to share with us. And she's just a wealth of knowledge. She has done so much research and publications and has vast practical experience of hijama case studies as well, inshallah. But for now, let's just get the interview going and I'll just do the basic introduction, inshallah. So Sister Ghazala, we met a few years back and she actually came to England. We did some training together, and she then also created a course with us, which is the Unani Typology and Prophetic Medicine course, which we offer. So alhamdulillah, she featured in that, giving some guest lectures for that. So we do have background in working with her, and Mahshallah, we know that how much valuable knowledge that she has that she can share with Hijama students as well. So welcome, Dr. Ghazala. Can you please introduce yourself and just give us your qualifications and your background and tell us about yourself.
Assalamu alaikum everyone. I'm Dr. Ghazala Mulla from Pune city, Maharashtra district, India. And I'm Associate Professor in Department of Physiology and HOD of Physiology Department in ZBM Unani Medical College, Pune. I've been associated with this college since last 24 years. And I have started doing hijama in the year 2012. I have started doing hijama therapy and I have started exploring very fascinating aspects of hijama therapy. And then I have written a book. So I'm the first Indian author to write a book on hijama therapy, which is in English. And this book is, the title is Hijama, A Legacy of Healing. Highlights of Hijama, Legacy of Healing, and it is approved by Central Council of Indian Medicine, Unani faculty, as a reference book for undergraduate student. And so far, 2,000 copies have been sold, and now I'm in the process of writing third edition of my book. And it is very well accepted by the readers, and especially the hijama therapists, those who are not in the college, but they are doing hijama at their clinics also, because they find it very simple, in simple language, and with illustrated images. And I have given all the references from Unani books, classical Unani books. So that is why it has got more academic value also. And I'm a researcher also. I'm doing research on uterine cancer. I'm doing research on liver cancer. And we have formulated one cream for psoriasis, which is nanotechnology gel-based cream. And I have also done genetic analysis of typology, that is personality. So this is first of its kind, and I have developed one software for assessment of typology or personality. And it is all these projects are funded by Ministry of Ayush, Government of India. So we thank the ministry that they have really doing wonderful job, and they are funding a huge amount for Ayush system of medicine, that is for Ayurveda, Unani, Siddha and homeopathy. So I have got 4 major research projects right now, and we have got about 70 lakhs of rupees each for each project. So this is all my introduction, and I have also, you can say, trained Unani physician or Unani graduates or postgraduates, those who want to learn hijama therapy. And I am delivering lecture regarding hijama therapy, and all over almost every major city of India I have delivered lecture, and the physician, they have got benefited with those lectures.
Excellent, mashallah, alhamdulillah. So that's really quite a big introduction. So before we move into your actual research, because I know you are extremely passionate, like next level, passionate and intensive, you know, you have devotion to your work, and clearly you enjoy your work. And so let's take it back to the beginning. When you were maybe in your teens, or you were deciding what to do for your career, what made you decide to become a specialist in Unani medicine? How did you learn about it? Like, what was your thought process when you were young and you decided, oh, I want to become a Unani doctor? What happened?
Actually, my dream was to become an allopathic practitioner. And I was, I have come from a very small village where usually the Muslim girls, they will not go beyond the 10th standard education and beyond the college. So I am the first, I have, right from my childhood, I was passionate about becoming a doctor. So one of my uncle who was a doctor, and he decided me to put in this college. And then gradually I started taking interest in learning medical field. And this is how I've come to Pune. That is from 90 kilometers from my native place. And then first time from our village, a Muslim girl landed into a medical college. So this is how my journey started.
Excellent. So what made you transition into a naturopathic, you know, why did you move towards natural medicine and Unani and come away from allopathic?
Again, in India, in certain states of India, the government, they allow both practices. That is, if you are having even the alternative system of medicine degree, you can practice allopathic, because we have been taught in the college the allopathic system of medicine. So where in my state, that is in Maharashtra state, it is allowed by the government. But when I'm taking even medicine for my minor ailments or for my patient, when I have started seeing patient before joining the college, I was doing my practice. So what I found that the allopathic, it is giving all the symptomatic relief to the patient. There is no permanent cure. Just a common example of common cold. If a person is having viral fever or common cold, there are no such medicine that can give permanent solution to allopathic. So that is why I have turned to Unani, or the herbal system of medicine. Then I have explored more books, and I have now started doing detailed, in-depth study of Unani system of medicine. And this is how I have turned to Unani system of medicine.
Okay, but I mean, it's a very, very complicated and intense science. The discipline on its own is quite detailed and complicated. And firstly, average people don't even know what Unani medicine is. And secondly, it's quite confusing for them. So what is it about that made you so interested or passionate? Why have you done a deep dive into Unani medicine? And can you also tell the viewers what it actually is and what does it involve?
Till recently, people were not aware about Unani system of medicine as such. Very in few cities like Delhi, like Mumbai, and other cities, especially in the North India, they are very well aware of Unani system of medicine, because it is the capital hub of Mughals. So the Mughals, they were having Hakims, and that is why it is very popular amongst the masses in North India. But in South India and in my state, very few people know about Unani system of medicine. And they know Unani is Hamdard. Hamdard company is very popular. So they know a few products about Hamdard company, and that is the only thing they know about the Unani system of medicine. So two of my colleagues, Dr. Ajmal Keti from Kerala and Dr. Sufyan Ahmed Ghaute, they were my classmate in the undergraduate college. So we thought of, why don't we should start a setup, a regimental setup, like in Ayurveda, it is called as Panchkarma. So that is where we do massage therapy, leech therapy, and this sort of therapies are given. It is not very well popularized. It has get immense, you can say, popularity during the COVID period. Okay, so when there was a COVID pandemic, and when there was lockdown, so people were searching very, you can say, maniacally, you can say, in search of COVID, or they want to have any prophylactic medicine. So in that time, the government of India and the Ministry of Ayush, they have reached to the Unani physician, and they have very online discussion. And so many times in that meeting, I was also the part of their meeting. And they said, okay, please you give any herbal formulation that can be used as a prophylactic medicine for COVID prevention. And then we have formulated one decoction, and that the government of India and Ministry of Ayush, they have zeroed down on one decoction, and that decoction was very popularized, and it is called as Joshanda. And people are starting using that Joshanda, and certain scientific studies have done on those Joshanda, and they have clearly get benefited, and they have protected from COVID. So from then onward also, it is very much well known. And then even the media person, especially the Ministry of Ayush, they have run a campaign to popularize every system of traditional system of medicine. They have made beautiful ads on TV, and this is how now the people are knowing the Unani system of medicine.
Okay, so Dr. Ghazala, I'm really interested in this concept of Ayurvedic Indian medicine is obviously the most commonly accepted natural remedy in India. And I know that Unani medicine is a combination of, they say, Arab or Greek medicine. So can you explain a little bit more about the history of it? Because you said that, you know, it spread because of the Mughals when they came into India. Tell me a little bit more about the Islamic medicine and the prophetic medicine side of Unani medicine, please.
We have not been taught a separate topic as such under the heading Islamic system of medicine or prophetic system of medicine. There is no any, you can say, book in our syllabus that will come under Islamic system of medicine or prophetic. I personally feel that the prophetic medicines are the medicine which are recommended by our prophet, beloved prophet, sallallahu alaihi wasallam, or he himself has used that. So when we are recommending any medicine to our patient, so we are having generally the patient in our college OPD and in my friend's OPD, we are having all mixed population. So when a Muslim patient comes to us, then we can recommend them that you use this, say for example, olive oil. In case of gallstones, you can use olive oil, and then Pustashiri we can use in different disorders.
Yeah.
So this is how, as per the patient's, you can say, religion, we recommend them. So we don't have any medicine as such which has been taught as under the heading Islamic medicine or prophetic medicine.
Okay. All right. So Unani medicine is a combination, traditionally, I guess, of Greek and Arab medicine. So how did the Indian government approach that, or what's their viewpoint? Because obviously Ayurvedic is it very different from Unani, or what are the similarities and differences, please?
There are similarities and differences in both the system of medicine. The major similarity is that both the system of using, they are using herbal medicines. The major portion of practice is based on herbal medicine. In Unani system of medicine, we are using minerals also, and we are using medicine of animal origin also. Whereas in Ayurveda, they are strictly restricted themselves to herbal medicine, and they are using minerals also, but not animal medicine of animal origin. As far as the basic concepts are concerned, they are totally different. The Ayurveda is based on mostly their religious mythology. It is based on religious mythology, whereas the Unani system is based on theory of humors, which is put forth by Hippocrates.
Okay, so basically the origins are of Greek roots. So summing up very shortly for a very simple person in a simple way, how would you describe Unani medicine by, there's the four humors. Tell us what typology and temperaments is, just as a very simple introduction for someone who does not know at all.
See, whatever food we are ingesting, first it is, you can say, transformed into the body fluids. So as per the Hippocrates theory, there are four types of humors in the body. They are blood, yellow bile, black bile, and then phlegm. So these are the four basic humors, and these humors gives temperament to any person. So there are always combination. So but one of the humor is dominating in each person. So that will be the temperament, or we can say mizaj of that person. So first, as a Unani physician, you should ascertain, or you should assess the mizaj or temperament of the person, then you will give medicine. So this temperament is not only restricted to human being. The temperament or the qualities are you can say we can implement it on the herbs also.
Okay, all right, I understand. Regarding the four humors in the human bodies, everybody has those, but they're just imbalanced or balanced depending on the foods you eat. Tell me how that is related to the blood of the person. When you are doing hijama cupping therapy or leech therapy, what is the point of that? How does that work with your humors?
It is very closely related with the humors, and with practice, years of practice, you will come to know what type of temperament and what type of dominant humors that person is having. As for example, if a person is of sanguine temperament or sanguine personality, so when you put the hijama cup on that person's body, the area become very red or congested in a little time. Whereas if the person is of phlegmatic humor, it will take time for the blood to come to that area, and there won't be any, you can say, congestion or redness in that area. Okay. Then if the person is of choleric person, so the quality of blood is not very bright red, it is somewhat yellowish red. Whereas in case of you can say melancholic person, the color of the blood is very dark color, and the consistency is also different. So in choleric temperament person, the consistency of the blood is very the blood flows very easily into the cup. So
Right.
this is how, by experience, you will come to know which type of blood is coming from which type of personality.
Yeah. So, but what's the point of hijama cupping therapy or leech therapy? How does it help a person by putting a leech on their body and taking blood out, or how does hijama help? What's the point of it?
There's a gross difference between cupping therapy and leech therapy. In Unani classical text, the use of leeches are very less. Leech therapy have been recommended for diabetic wound, non-healing ulcers. In such cases, you can do leech therapy where there is a superficial congestion. So the leech will not draw the humors which are deep-seated in the body, and they have become morbid. Whereas in case of uh, hijama, you are drawing the morbid humor, deep-seated morbid humor from the body. So most of the time, it is very extensively indicated for the use of hijama. So it is not just the drawing of the blood, the dry cupping also, fire cupping also, different types of cupping. It has been extensively indicated in Unani classical literature.
Excellent. So tell me about your hijama journey. Exactly how did you discover it, and what made you decide to specialize in it so much? And I know you're very, very passionate about it, and you have strong faith and conviction in it. Tell me about the actual hijama side of it when you learned that, and how it all started for you.
Yeah, actually, my journey begins with one blog. There was a former director and advisor to Government of India from Unani System of Medicine in New Delhi, Dr. Asad Pasha Sahab. I owe all my learning to him because he has guided me. He has just given me one website, and it was Shoaib Surya. You must be knowing him.
Yes,
He has sent me the link, and he said, "Okay, you visit that website and you see what is hijama all about and how it has been done." So I visited that website, and then I start searching all Unani literature. So we have learned the theoretical part of it.
right.
We have not learned the practical part of hijama, how actually it has been done.
Okay,
So, okay. So then one of my colleague, Dr. Ajmal Keti, he was doing hijama, but in a very, you can say, primitive form of hijama. Then I started reading the articles on their website. And in 2000, I think in 2012, or yes, in 2012, they have posted one blog, 2010, September 6, 2010. they have posted one blog and they have taken my written interview on cupping therapy. So then I said, okay, I don't know much about cupping therapy and I'm learning cupping therapy and I'm reading your article. Then again in 2012, they have posted one blog, okay, who should do hijama, whether medical doctor, only the medical fraternity people, they should be doing hijama, or any person from any background, they can do hijama on different people. So from as I'm from medical side, so it was my strong belief at that time that only the medical fraternity people, they should be doing hijama. So they have posted my blog and then I have started gaining interest, and it is a self learning process. Then patients start coming. Initially, then I am doing hijama at my college OPD, only one or two patients, and then we have started learning. So this is how it started. We have started our journey of hijama.
Can you tell me a bit more about your books and your research papers that you've had published, please?
Okay. One of the professor from Aligarh University, Dr. Kamar ma'am, she always visited our college for postgraduate examination. So we were discussing about cupping therapy and how I'm seeing different case studies I'm taking up. So ma'am asked me, why don't you write a book on hijama therapy, because you have got so much of material, so you can compile a book. So basically I'm from Urdu medium, so my English is not that much good. So I said to madam, I won't be able to write a book. Then there was another senior lady in our college, Dr. Nasreen ma'am. She's MBBS MD. So she said, "Okay, you start writing Ghazala the book, and whatever the correction part or editing part of it, I'll do it." So this is how I wrote a book, and then I started reading Canon of Medicine, Al-Hawi Fitti. That is what when I was reading the classical literature, I found that there is no separate chapter as such of cupping therapy or hijama. So
Right.
people are finding it difficult to find out the points for different diseases. So I started searching all the books and then I compile all those points for different diseases which has been mentioned in classical Unani manuscript. And this is how the shape of the books comes then.
Excellent, Mahshallah. And once those were published, obviously many universities and research centers contact you, and you've been doing lectures and teaching all over India. Tell us about the actual research that you carried out. How did you do that? And I know some of your colleagues helped you with extensive details regarding the actual research of your clients. Which conditions did you treat?
My research started when again one of patient, the lady, she said, what is the difference between blood donation and undergoing hijama therapy? He said, again in blood donation we are donating the blood and we are doing hijama, and how hijama will treat the diseases. One of her family physician, he was teasing her or mocking the process of hijama, that it is not effective at all, it is just a placebo therapy. So I discussed the matter with Dr. Nasreen Pathan, and she said, "Can you do one thing? You collect the venous blood, that is blood from the veins, and you take the hijama, do the hijama of the same patient, and collect the blood of hijama and send it to the pathology lab, and then we run certain tests, and we will see the difference between the venous blood of the same person and what is the difference between the hijama blood." So the result was very surprising, that as you know, the urea, uric acid, bilirubin, cholesterol, they are very harmful to the body.
Yes.
So in hijama blood, we are getting the more quantity of these end product, you can say. So with this study, we can conclude that definitely hijama, it eliminates the toxic material from the body.
Okay,
And
so you actually found more uric acid and cholesterol, you said?
yes, and bilirubin.
Wow, mashallah, that's amazing.
Hmm.
And then from there, what other research have you done or case studies?
Then again, one of the ladies, she was diabetic and she came to me for hijama. So I said I was very scared to do hijama for a diabetic person, because if God forbid any infection occurs after hijama, so who will be responsible? So I said, okay, I don't know any points for diabetic for hijama. So you do one thing, you come after 8 days. And she landed up again to me, and she said, okay, you do hijama. I said, to be very honest, I don't know the points of hijama. And if any infection happens, so who will be responsible? She said, I'll give you undertaking that whatever will happen after hijama, because she is having so much strong faith in hijama. She
Yeah.
has undergone hijama in Dubai, so she knows the effect of hijama. She said, "Aap karo hijama, nothing will happen to me." Then I started doing hijama, and gradually, what she said that my blood sugar level is dropping. Her fasting blood sugar level was 350,
Right.
and then after successfully doing hijama every month, it is dropping. And she was a very educated lady, so she was keeping a record of her blood sugar level of every day, fasting and after 2 hours of eating breakfast. So when she gave me that results, it was so amazing. And fortunately, there was a conference, international conference on cupping therapy in Istanbul. So I sent my synopsis to them, sorry, abstract to them, and they were very pleased with that. And they said, "Okay, this is first time of any, you can say, scientific data they are having on diabetes, cupping therapy, and hijama." Then that case I have presented in Istanbul, and then I have started taking blood samples. Then when I was searching net, I have come across one paper, and it said that there is a chemical, it is released by the body when you are doing hijama, and it is called as epidermal growth factor. And that epidermal growth factor, it causes your body to use glucose. So your cell start using glucose. So when your cell start using glucose, there will be no high level of blood sugar. So to prove this theory, what I have done, I have taken blood samples from healthy individuals and blood samples from diabetic patient who has not undergone hijama therapy. Then I have done hijama on them. And after few episodes of hijama or few session of hijama, I have again collected their blood. And I have sent it to my friend's lab. And there they have assessed the level of EGF, blood serum level of EGF. And I've got that you can say the data with me. It is very 3-5 patients because the test is very costly, and nobody is funding me for my this project.
Okay.
But so one of the very you can say a lady scientist, her name is Kalpana Joshi. She said that your hypothesis is very strong, Ghazala. So she has given this topic for post graduation research to her student,
Wow.
and they have assessed the EGF level in diabetic person and in normal healthy person, and they have done the study at the genetic level.
Okay.
Unfortunately, the paper has been published, but it is a paid article, so I cannot share the whole article with you
Okay.
people. But
Right.
it was published in a very reputed journal, and the name of that journal is the Gene. The Gene Report is the name of that journal, and in that it is a paid article. You have to pay the amount, then only you will be able to read. But this is the basic, you can say, research. So if anybody want to, you can say, take up this research, they can take up in any country and they can carry on with this. So I have a strong, very strong belief that hijama, it controls the blood sugar level. It even controls the glycosylated hemoglobin level.
Wow, Mahshallah, that's amazing. Yeah, I mean, we definitely need much more hijama research like this on a medical level, scientific level for the hijama community. It's amazing all of the work that you're doing. So do you have any other books that you would like to share with us or any other research publications that you have?
Yes, I have also published. I want to share one of very interesting case study which I have taken up, and it is with Hijama. I have a strong belief, and I have published that paper also. That I will share with you all people. There was a lady. She has come in the year uh, 2016. She has come to me April 19, 2016, because I'm an academic person, so I keep all the records of the patients.
Right.
So, yeah, she was suffering from breast abscess, right-sided breast abscess, recurrent breast abscess. She was having the episode of breast abscess since last 3 years, and she was visiting a very well-known surgeon of Pune city. for evacuation of that abscess. So every year she went to that surgeon. The surgeon evacuated the abscess. For 7, 8 months she was all right, and then again the pus start collecting inside the breast. So someone suggested my name that she's doing hijama, you can go to her. So when she came to me, her right breast was very swollen, red, very tender, very painful. She was in a very bad shape. So I asked her to apply red lentils, masoor ki dal we call it as.
Okay.
And yeah, I asked her to make a paste of it and just warm it, little bit warm, whichever she can bear. And I asked her to apply you can say sort of a covering on her breast. And I asked when the abscess burst and when there is a oozing of pus, you come to me. And then
Okay.
after 8 days, she came to me. There was a little hole from where the pus was oozing. So I put the cup. I said, there will be pain, but you have to bear it because I haven't given any anesthesia to her. And after I have taken out the pus, 6 big cups, one number cup,
Wow.
six.
My God.
That was the amount of pus I was drawing. And then every day I was drawing the pus from her breast, and one day there will be no pus discharge, and there was a very big hole inside that. So in Unani medicine, it is written that raw papaya is good for healing, wound healing. So what I done, I grated the raw papaya and put it under the gauze and make it a roll, compact roll, and I put it under the breast pocket where there was a big hole. And daily I was doing this dressing and I was doing cupping, drawing the blood and pus, whatever coming out. And then I have also given certain medicine to her, herbal medicine, and she was under my treatment for 50 days.
Wow.
And Mahshallah, her abscess was totally gone. And after every that healing, complete healing process, I have taken her sonography, USG, of her breast, and it was absolutely normal. There was no calcification, no destruction of underlying breast tissue. And she was, mashallah, healthy. She still visit to me for cupping therapy or hijama therapy.
Mashallah, mashallah, that's amazing. And not only the level of pain that she would have gone through and discomfort, but to consistently have that recurring over several years, it must have been very distressing for her. And then obviously to have an easy solution from you, mashallah. And subhanallah, look at the beauty of it. It was just completely natural. You used food and you
Yes,
used cupping, which is
yes.
just amazing. That's such a good result. So, mashallah, you've got lots of experience and knowledge. Can you just share any case study that is so strong that it had a powerful or even an emotional effect on you when you saw the results, that it's affected you or your outlook on life or how you approach health and medicine and things like that? Have you come across any miracle case studies that kind of blew you away with the results? Besides the lady you just told us about, of course.
Again, there was a young girl, and she has got a tear in her ligament tear in the right knee. She was gymming, and during gymming, there was a tear in the ligament. And again, she was under treatment for complete 1 year with the orthopedic surgeon. And then there was effusion collection of fluid, and she came to me with such a big knee. And the surgeon said, okay, you have to put needle, you have to aspirate the fluid. And she was fed up by that time. Since last 1 year she was with the surgeon. Then
Right.
she came to me, and after doing hijama, and initially I thought, okay, ligament tear, how can it be healed with hijama? So
Yeah.
I said, let's start with. And she is again, actually the patient are having a strong faith in the doctor as well as in the therapy. She said, I'm completely surrendering to you. Whatever you want to feel good for me, you should do. So I started doing again hijama. And when she has under again gone MRI report, and then there was a complete healing of that ligament. So even we can say that the ligament tear can also be treated with hijama therapy. The picking of the patient for hijama therapy is very important. We should be able to pick up the right patient. Then only we will get a miraculous result of hijama therapy. So that is very important. So over a period, say since last 2010 to this time, whatever I have learned from my own experience is that the musculoskeletal disorders, they are very important, and so many patients, they are coming to us for a frozen shoulder and knee pain, especially knee pain patient. Every second or third person is having knee pain. So when we are doing dry cupping therapy or dry hijama, and when we are doing wet hijama, we are getting wonderful results with this.
So I definitely believe 100% in hijama as well, but you obviously it's part of your training to combine foods with it and herbs. Do you, when you integrate your medicine, because you have allopathic background or knowledge, you also combine the herbs and food and the hijama, what kind of results do you get when all of those three things are combined powerfully? And do you feel like the results are quicker, or they're, you know, much more powerful?
Usually, what I feel that hijama, I take it as an adjuvant therapy. If the patient is having pure muscular disorder, then only hijama will do wonder. Okay, but say for example, even I have treated status asthmaticus patient. It means severe asthma. Such patient, those who need hospitalization and
Right.
those who need IV drips. Again, that lady, she said me, I'm not going to go to hospital. You do hijama to me, and I have done fire cupping on her.
Okay.
And I said, okay, within 10 minutes, if you didn't get relief, please go to hospital and get admit yourself. She said, okay, and I have taken her number, and I had said, you call me after 10 minutes. And she said, after 10 minutes, I'm all right. There was no any breathlessness, no any dyspnea. So that is again a very, you can say, good shock to me. Fire cupping can work beautifully in case of asthma patient. She used to take 5 times inhaler daily and steroid. Without that, she can't even do any household chore. And once I have started doing hijama on her back, on her lung area, she is not taking a single allopathic medicine and inhaler till date.
That's amazing. Yeah, I mean, fire cupping is just so therapeutic, and I think that there must be the element of the fire or the heat that draws out certain toxins from the body as well. So that's just very profound. Would you be able to just very quickly break down the best amount of hijama cupping therapy or techniques for each typology or temperament? So if a melancholic person comes to you, how, obviously every case is different, but what would the average amount of treatment be, or how would you treat them, or if it's a choleric and so on?
Melancholic person, they need more hijama sessions.
Okay.
Because their elements or the humors, they are very deep seated, and they require more sessions. Whereas choleric person, few sessions will do wonders to them.
Okay.
And then again, a sanguine person, they require more session than choleric person, but less than melancholic person.
Okay. All
Okay.
right. Yeah.
And the phlegmatic person, again, they require more session, but lesser than the melancholic.
Okay. So melancholics require most.
More
Then
session.
it's sanguine or phlegmatic.
Then comes the sanguine.
Okay, and then phlegmatic, and then choleric.
Then choleric.
Okay, that's really interesting to me, because I found cholerics have runnier blood, or sometimes there's more yellow bile. Like, I'm a choleric. In my case, you know, it feels like maybe I'm used to it. I just feel like I need hijama a lot all the time. So can you explain how sometimes when you do hijama, the blood separates from other fluids in the body? Because sometimes there may be combination of yellow fluids or clear watery fluids. Can you describe that and explain it, please?
So in choleric person, the consistency of the blood is thin. How the yellow bile is formed in the body. The Unani concept is that maybe the allopathic person or the modern science people, they won't, you can say, they will not accept my theory, but as a Unani physician, I am saying,
Yes.
as per Unani system, whatever food you ingest, it first transformed into phlegm. Okay. and then from phlegm it is turned into bile, and then it is you can say more transformation occurs in that, and then it becomes blood. So you can say the yellow bile is the raw form of the blood.
Okay.
It is the raw form of the blood. Okay.
Right.
So it has to take certain time. It has to be cooked by the body. Then it will be transformed into the blood. Okay. And the rest, whatever the good quality of blood has been, you can say, utilized by the body, the rest, which is residue, it will be the black bile.
Oh,
And that is, it is not considered as very good quality of humor.
which one, choleric or melancholic?
Melancholic, melancholic.
Okay.
That is the black bile.
Yes. All right. That's really interesting. So when you say that everything, whatever you eat, converts to phlegm first, does that include mucus as well, or what do you mean exactly by phlegm, or is that like any other watery fluids in the body? What does that mean?
Phlegm means you can take it in a context of lymph in
Right.
the body. That is
Okay.
the white fluid in the body. Also, whatever white fluids are there in the body, you can consider them as a phlegm. Actually, I'm writing a book. The most you can say asked question to Unani physician is about the black bile, or it is called as sauda. So
Yeah.
nobody give the concrete answer or scientific answer what is bile, black bile. So in the Unani textbook, it is written that it is formed in the spleen. In the
Okay.
spleen. Okay. So then I have studied the histology of the spleen, the microscopic and ultra microscopic structure of the spleen, and I have studied the degradation of RBCs in the spleen. It occurs in the spleen. So what I have come to the conclusion that the hemosiderin, that is the end product of iron metabolism.
Yeah.
It is the hemosiderin, and it is black in color. And there are various derivatives of iron metabolism, end product of iron metabolism. So they are the bile. They are the black bile.
Oh, I see. Subhanallah, that's amazing.
So this is how I'm correlating.
Yeah. So obviously other people may have other opinions from medical background, but you are a Unani physician, you're highly specialized, and mashallah, you're doing intensive research. So in your conclusion, in the spleen, that was the black bile, that was the residue of that. And you're summing up phlegm as maybe lymph. So could it be mucus as well?
Yes, definitely.
Okay.
In Unani, the phlegm, they have classified into various types.
Right.
So into various types. So if you take mucus from the, you can say mucus gland, and then you consider certain secretions from the pituitary or endocrine gland, then you can consider the lymph also. So they are having different composition, they are having different consistency also. So
Wow.
again, here the Unani theory proves right.
Yeah, of course. I mean, I definitely believe in it 100%. Whatever is natural and organic has come from Allah, and we know food is the best medicine, so there's no disputing it as far as I'm concerned. Can you have a reductionist conclusion regarding sanguine or the blood element, and also, so we've done black bile, we did phlegm. What about yellow bile and blood? What's your conclusion about that when it's in its raw form or reducing? Do you have any research about that or any ideas maybe?
Whenever any person is having any acute disease,
Yes.
say for example, if any person is having any acute attack of skin rashes, or any person if is having acute attack of vomiting or diarrhea, sneezing, any sort of acute attack, it is caused by bile.
Okay.
It is because of yellow bile.
Oh, right. Okay, that's interesting. And with blood, the usual common disease.
Yes, because why I'm saying that yellow bile is causing all the acute and very emergency situations is caused by bile, because in Unani book it is written that a yellow bile is like a watchdog. It's watching
okay.
your body. So
Right.
whenever any attack comes to your body, the bile is the first one to get reactive to those attacking substances.
Wow,
Okay.
that's amazing.
So that is the thing. And the regarding the black bile, it is written that the black bile or the melancholic person is like a solid rock, or it is like a very big hill. Okay, mountain. Sorry, a very big mountain. So
Right.
if you want to treat a melancholic person, you have to really shake him up. That is, you have to give fourth grade medicines to such persons.
Fourth grade, you mean temperament of the food, like how hot it is or how, okay. All right.
First, we have to ascertain the temperament of the food also, the temperament of the person also, and the temperament of the drug also, or medicines also.
There's just so much knowledge to learn that, it's such an interesting topic to me as well. I'm really fascinated by it because there's obviously not much research, and the fact is that it is natural and organic, and all of these things interest me, mashallah. So it's amazing to learn so much more. We are running short on time. I'm conscious that you are on a schedule as well. So I guess just one final question. Most people would ask this. You've looked at the temperaments of the actual humorology, but regarding a person's personality type, for example, if someone is having behavioral issues or mental health issues, and you've given them certain foods and herbs and remedies, but they're still behaving in a certain way, how do you treat that person with hijama based on their behaviors or their typology, I guess, or their temperament?
Usually, the melancholic person, they suffer from psychological issues. They are always on downside. They always ask themselves, why me? Why Allah Ta'ala has given me this and that? This is what is the, you can say, usual type of melancholic person. So I'm doing hijama on sacrum part, that is the tailbone, and on calf muscles.
Okay.
Any person, those who are coming to me for depression, for anxiety issue, and for schizophrenia, all those sort of psychological issues, if they are coming to me, I'm doing hijama on sacrum and
Okay.
on calf muscle, and I'm getting good results. The person, those who are having habit of taking sleeping pills, and when they I have started doing hijama to them, I'm getting wonderful result on sacrum. Here again, I have just put my logic. There is no such point mentioned in any book, in
Right.
even in Unani book also. Most of the time, what is the people's thinking is that, or any hijama therapist, okay, if the disorder, if there are psychological issue, we should do hijama on head.
Yeah.
Okay. But one of my concept is that whenever there is an increased intracranial pressure in the head, we do lumbar puncture.
Yes.
The fluid we take out from lumbar area. So why not we do hijama on those area, so that the intracranial pressure will be reduced, and then the flow of humors will be towards the lower body. Because one of our concept in for doing hijama is that you take the morbid matter away from the organ,
Yes.
then you will get good results. So that is the my idea of putting the hijama cup on sacrum and on lower calf muscle, and I'm getting good result with that. So
Okay.
any psychological issue I'm treating with that.
Excellent. So from my knowledge, for example, if a phlegmatic person comes to you, if they're very anxious or they're a worrier, they worry about everything, or, sometimes they're a bit down or whatever, what level of hijama would you treat them with if they've got, kind of mental health issues as well, for a phlegmatic person?
So I usually put one sunnah point, that is the just below the neck, that is at C7 level, and one at sacrum. These 2 points will suffice for every personality type. But the frequency I'll change. For
Right.
example, if the melancholic person comes to me, I'll call them every 15 days.
Okay.
Whereas in case of say the phlegmatic person, I'll call them once in a month. That will suffice them.
Okay. And what about choleric and sanguine?
Choleric and sanguine, sometimes the choleric person, they will just respond to one session also.
Oh, okay, that's interesting.
Ah.
So, I mean, cholerics can be quick-tempered or argumentative. They're a bit hyper. So,
Yes.
with Hijama, you're saying even that could calm them down even after one session or just a few sessions. Is that right?
Yes, definitely. Definitely.
Okay. And sanguines are quite chilled out and relaxed people, are optimistic. So if a sanguine presents with mental health disorders or they're taking medication, where would you treat them for with the Hijama, or for how long?
Again, for sanguine person also, I call them twice in a month.
Okay.
Because the blood part is dominating in them. So it is the blood that is causing havoc and that is causing them the psychological issues. So when we are doing Hijama frequently, then definitely we'll get good results with them.
Excellent. Alhamdulillah. Thank you so much for sharing all of your knowledge with us and taking out the time to speak to me, especially today. I do really appreciate it. Do you have any final words or a message for our viewers? Obviously, these are people who are interested in anything that's natural or to do with mind, body, and soul, anything to do with Hijama cupping, Unani medicine. What's your message for everyone?
My message will be you should believe in Hijama because it has got miraculous result. It will give you result in musculoskeletal disorder. It will give you results in digestive system disorder, that is IBS. Again, you will get wonderful result with IBS. Then you will get wonderful result with the psychological disorder or with the mental issues. So even if the science, you don't have any scientific logic, but believing and having faith in Hijama, definitely you will get very, very good results and 100% results with Hijama.
Excellent, alhamdulillah. Thank you very much. Jazakallah khair, sister. It was lovely seeing you again. And I just enjoy talking to you so much. There's just so much to learn from you, mashallah. Thank you very much for joining us today. And I hope you enjoyed yourself as well, inshallah.
Inshallah, same here. Thank you.
Thank you so
Jazakallah.
much. Assalamu alaikum.